Hello everyone, I'm Julie Parsons. I'm a co-convener of the British Sociological Association Food Study Group, and I'm very delighted to welcome you to the third of our four international webinars. And yes, and I'm going to hand over to Anna, who's going to chair today's session, because she's invited our esteemed guests and is going to do a little bit of an introduction. So Anna, over to you.
Great, thank you very much. So yeah, I'm Anna, I'm on the BSA Food Committee, and I'm really delighted to introduce Sarah Bowen today to give this seminar. Sarah is a professor of sociology at North Carolina State University in Raleigh, and she teaches on things related to health, food and inequality. She's written 2 books, Divided Spirits, Tequila, Mezcal and the Plastic Production, and Pressure Cooker, Why Home Cooking Won't Solve Our Problems and What We Can Do About It. And currently, she's principal investigator on a project that's funded by the National Association, which is aiming to understand the impacts of the pandemic on people's experiences of food insecurity and coping strategies in 5 states in the US. And that's what we're going to be talking about during the presentation today. And it's especially exciting for me because we're doing some similar research in the UK, so I'm really looking forward to thinking about what the kind of similarities and differences and experiences are. If you have any questions during the presentation, feel free to put them in the chat box, and then we'll have a Q&A session afterwards. So, yeah, I'll hand over to Sarah to share her screen.
Thank you very much. I'm so happy to be here. I wish I was really there, but one of the benefits of the pandemic is that people are doing more of these kind of long distance seminars and things, and it's really nice to be able to share this research with you. And I'm going to share my screen. And so today I'm going to be talking about some preliminary results. We are actually just wrapping up data collection, so we are still doing our field work of research that I've been doing with a team of people in 5 states during the pandemic to look at how food insecurity has changed in the United States during the pandemic, and what does that tell us about inequality more broadly. So to get started, I'm just going to start with a tiny bit of background on food insecurity, how it's defined, how it's measured, because that seems to vary a bit by country. And so to start, the USDA, which is the Department of Agriculture in the US, which covers both farms and farming and also food insecurity and food assistance. So they have been tracking food insecurity since the mid-90s, and they define food security as when people have enough access at all times to enough food for an active, healthy lifestyle for all household members. And so their official definition differentiates between high food security and marginal food security, which they count as being food secure. So this might mean being anxious about food, but having enough. And then they lump together low and very low food insecurity. And so low is often reducing the quality or the variety of foods people are eating, but not having to cut back on a lot of food or skip lots of meals. And then very low is when people are reporting indications of skipping meals, disrupted eating, lots of shortages in terms of quantity. So that's what they consider to be food insecure. And there aren't really comparable international statistics that would let us use those exact measures and then say, well, that's what it's like in the US, what is it like in other countries? But there are some polls that give some indications and that ask, the same question of all countries. And I'm curious what people have to say when we get into the discussion. But the polls suggest that the US and UK both have unusually high levels of food insecurity compared to other wealthy countries. So I found one report from UNICEF, and they were looking at child food insecurity. That's what this graph is, and I'm sure you can't see all the countries, but the United States and United Kingdom are right next to each other, with 19.6 and 19.5% of children under 15 living in a household with someone who is food insecure. And in comparison, some of the industrialized countries like Japan and Sweden have rates that are more like 1% or 4% for that same measure. So now returning to the United States and also looking specifically at the pandemic and what it has changed. So this is looking at food insecurity since 2001. And you can kind of see it has fluctuated. It has hovered in kind of a relatively narrow range since they started measuring it. So since the mid-90s, when the USDA started tracking this using these measures, it has fluctuated in the US between 10 and 15%. So it goes up and down according to the economy. But during the pandemic, that all changed, which you see at the very end. And between February and March of last year, the surveys indicate that rates more than doubled overall and tripled among families with children. So a huge jump and something that is truly unprecedented. And then just to talk a little bit more about the context, I think there are a few important things. So the first thing is that obviously this is a huge jump on something unprecedented. A second point related to that is that the increase among children and households with children has been especially high. And not just that the household is experiencing food insecurity, but that child food insecurity itself, where the kids themselves are experiencing the effects, has increased during the pandemic, which is significant given that there's lots of research about how parents, not so surprisingly, will do everything they can to try to buffer their kids, even if the house is experiencing food insecurity. So child food insecurity has gone up during the pandemic. Another point is that it rose very quickly last year, but it really has stayed kind of stuck up at those high levels. And these graphs end in November of last year, but I've seen some more updated statistics and they don't suggest that it's gone down very much. And then the last point, which I'm going to be talking about a lot today, is that there are huge disparities by race and ethnicity. So with nearly 1 out of 2 Black families with children experiencing food insecurity, with Latinx families not far behind, and then it's more like 1 out of 4 white families with children. And then the last kind of contextual point is to point out that there's a lot of variation by place. So before the pandemic, the counties with the highest rates of food insecurity were disproportionately rural and in the southern United States, which is where I live in North Carolina. I don't know if you can see when I shake my cursor around, but right here. So these were pre-pandemic, the places with the highest rates of food insecurity. And these are also places with high shares of people of color. So in the Southeast where I live, and especially this part of the Southeast, Mississippi, Alabama, these are places where they had the growing conditions that slavery was most profitable, and they still have higher shares of Black people today. And they are also the places that have long had the highest rates of food insecurity. And of course, we know that also the pandemic's effects have not been experienced equally by race. So people of color are more likely to have lost a job and to have gotten COVID and to have known people that have had serious effects, have been hospitalized or died from COVID. And so we won't know for sure exactly how this is played out, but the pandemic is going to kind of lay on top of these patterns in terms of food insecurity. And so the last little contextual bit before I get to our research is just to talk a little bit about food assistance, since this is like super important in how people have experienced and coped with food insecurity. So the most important food assistance program in the US is called SNAP, Supplemental Nutrition Assistance Program. It used to be called food stamps. And so this gives people money on a card to buy food. The amounts can range pretty widely. So the minimum for 2 people is $16 a month, which is almost nothing, but it can go up to $355 a month for 2 people. Then some other kind of important programs are free and reduced lunch, which is in many places only for people that have certain income levels. In some schools, they give it free to everyone. And then the WIC program, which gives vouchers for specific foods, and that's specifically for little children under 5 and babies and their moms. So those are some of the kind of pre-pandemic food assistance programs. During the pandemic, one of the first kind of response bills that was passed last March included $1 billion in food assistance. So there has been a big expansion in food assistance, and it happened quite fast. So one thing they did was that they boosted SNAP benefits so that everyone was getting the maximum, which if you were making the minimum before could be quite a big jump. It also let states be more flexible in implementing, and it also made it easy. It provided PEBT, which is more SNAP and I know this is a lot of terms, but that was for people with school-age children, because one of the big questions last year at this time when they were trying to discuss should the schools close, should they not, was how many families depended on the schools specifically for meals. So everyone who had a child who had been getting those meals got more money on their cards to kind of make up for it. Even so, as I'm sure is the case in the UK, there's been a big increase in demand for food pantries and food banks. And the one in our area talked about an increase of 38% over the previous year. And then they also have additional challenges because they, in terms of getting volunteers and donations, and also having to adapt their programs, like to let people come in cars instead of coming in the building. So, as I said, we don't know exactly how the pandemic has altered patterns of food insecurity in terms of like statistics and these kind of statistical relationships and generalizable relationships that I've been talking about. In September is when the government does their big report, and it's got a ton of detail. And so in September, we'll know what happened in 2020. Until then, we're kind of piecing it together with different studies. But we can expect the pandemic is going to exacerbate some of these inequalities, and then it may alleviate others or alter them. And so our study is a qualitative study that's looking at how are people coping, what are their experiences of food insecurity, what strategies are they using, who is accessing assistance, who is not, and how have some of these things changed. And I will highlight just a few things about our methods, but like I said, we're still in the field. I would love to talk about methods if people want to talk about that, and doing field work during pandemic has been a new challenge for us. So this is our study, the first study, which looks at how people are feeding their families during the pandemic. And what we are doing, we're working in 5 states. Those are very small red dots on the map, but you can kind of see them. They're kind of all over the US. So 2 in the north, South Dakota and Michigan, and then 3 in the south, North Carolina, South Carolina, and Mississippi. And we specifically picked a rural and urban county in each of those states. And then we're doing 2 interviews with each families. So we're kind of doing a first interview that talks about their general experiences during the pandemic. Then we're collecting photos of their food environments, so shopping, meals, pantries, things like that. And then we're doing another interview that focuses a bit more on food. And we are planning to follow up. We'll start the follow-ups very soon because we started in the fall. So we're kind of getting to 6 months for some families. And so we're seeing lots of changes and lots of patterns, both kind of comparing what it's like to be in certain places, but also lots of changes over time, since it has taken us a long time to do this kind of recruitment. So we started in the fall, and we've seen people have talked about, losing jobs, gaining jobs, health effects, all sorts of things. And so, like I said, this is sort of our preliminary research, but which is why I'm very excited to share it with you and also just hear your thoughts. And we are definitely still analyzing the data since we're not even quite done collecting it. But the argument I'm going to make here and the kind of findings I'm going to present are how food insecurity before the pandemic, but especially during, is a product of structural gendered racism. And so I'm taking the definition from an article that just came out from Purtle and Wright, and they define it as the totality of interconnectedness between structural racism, which is how racism is reinforced through inequitable social institutions and maintained and reflected in ideologies, culture, and the distribution of resources, and structural sexism, or systematic gender inequality in power and resources tied to culture, ideologies, and identities. So these 2 kind of layering on top of each other. In their article, Purtle and Wright, they are using it to look at inequity in terms of exposure to COVID and health effects and mortality rates and things like that. In our paper, we are looking at how food insecurity is a product of structural gendered racism that concentrates women in low-wage jobs, and especially women of color, that offers little care infrastructure to account for the unpaid labor that women do, and also relies on racist ideologies and infrastructure that restrict people of color's access to benefits that could help them in this situation. And I am going to tell a few stories from our research as a way of illustrating this argument. And like I said, this is kind of something I'm still thinking through, so I am super excited to get your feedback and questions. So the first point is that many of the people in our study were low-wage workers who have disproportionately suffered from both the health effects and the economic upheavals of this pandemic. So they worked as nurses' aides, school janitors, cafeteria workers, grocery store workers, in kind of warehouses. And in a lot of cases, when everything shut down in March, they lost their jobs with almost no notice. Many of the people were out of work for months and very few received unemployment, which this is in 5 states, but in North Carolina, where I live, we are one of the worst states in the country in terms of unemployment. And then as mask wearing and opening back up became these huge political issues, these essential workers were also kind of dealing with those consequences because they were at the front lines of these debates. So one of the moms in our study was Amy. She was a mom of 5, a single mom and a waitress in Raleigh, where I live. And she had been working at a diner in the breakfast shift for many years. And this was because it let her come home in time to get her kids when they got out of school. But when the pandemic started, she needed to change jobs so she could get another job because her kids were going to be home during the day. So she got another job and was spending every day supervising these virtual school schedules. And then she'd go to work at 4:30 at a sports bar and work until midnight. And the additional challenge was that as a server, she was responsible for enforcing all of the rules around masks and things like that. And she said it didn't work that well because her income depended on tips. So she only earned $2.13 an hour, which is the tipped minimum wage in the United States. Like the income really does depend on tips. They're not extra. And she told us when we did the interview about a night the previous week when she'd had only one table and she made $7 for the whole shift. And she said, you know, I came home and I just cried about that experience. And she was working 5 or 6 nights a week in addition to taking care of her kids and still constantly stressed about food and money. The tipped minimum wage in the United States, I think this is shocking. Like I can barely believe it. It has not changed in 30 years since 1991. And the minimum wage has not changed since 2009. So a lot of the people in our study were working in jobs that were in these sectors. They were also disproportionately exposed to COVID. And so we also had a lot of people, while Amy kept her job, we had lots of people who said that they quit because the COVID was rampant in their workplaces. They worked in retirement homes or distribution centers and they saw it happening with their coworkers and they decided they had to quit even though they didn't know what they do. And, you know, going back to the point about gendered structural racism, many of the job sectors where women work, and especially women of color, are the ones that were the most hit by the pandemic, like retail and restaurants, and both economically and in terms of health effects. And this is related to the next point, which is that the pandemic has revealed what lots of people knew already, which is how we in the United States devalue and don't support women's care work. We just kind of expect them to do it on their own and pick up the pieces for everyone else. 2.3 million women in total have left the workforce in the United States since the start of the pandemic. And the labor force participation rate for women is the lowest it's been since the 80s. And a lot of the attention, I think, in the news has been on professional women and how they're dropping out or their opportunities for promotion are being blocked. But job losses have been greater for women of color. And so as a proportion of the employment levels before the pandemic, Black and Latino women are working less than any other demographic, and women are lagging behind men in all racial and ethnic groups. And this is due in part to the need to care for children. So lots of schools are still virtual. Some of them are hybrid. So people are making the choice. Do they feel safe to send their kids back? Do they want to keep them out? And in lots of cases, when someone has to care for the kids, it's the moms. Almost no one in our study, I can't think of a single person, although there may be 1 or 2 people, was able to work from home, as I, as a professor, have been doing in this pandemic. Some of them could shift their schedules like Amy did. Some of them had partners or other people who could watch the kids, but lots of them quit their jobs when the kids switched to virtual school. So the mom I'm going to talk about here is KIARA. So KIARA was a single mom of 1, in rural North Carolina, and she worked as a healthcare aide when the pandemic started. She had been doing this for a long time. She loved it. She said she said she thought she was good at it. But her 10-year-old school switched to virtual, and so she had no choice but to quit. She was out of work for 8 months. She said they got by with food stamps, with some careful budgeting, and by depleting their savings. And the only reason she went back in January because her neighbor said that she could watch her during the morning. So KIARA paid very high costs for keeping her child out of school. She said school did not go particularly well for her child either. She didn't like it and she wasn't learning that well. But KIARA didn't think it was worth the risk of getting COVID, especially when she'd heard about people at her kids' school getting it. And so KIARA and many of the parents in our study worked in jobs that exposed them to risk. And KIARA was also a Black mom. And as I said, Black people in the United States are much more likely to know someone who's died of COVID. And so in KIARA's case, and in the case of lots of people, she reasoned, we have this one amount of risk that we're exposed to, and that's all. Like, we cannot do any more. And so she was willing to make some very stark choices in order to not expose her daughter to more risk. And this brings us to the third point, which is that before the pandemic and after, food insecurity is not just about access to economic resources, although obviously those are critical and also hard to get to everyone, but also that racist ideologies and policies restrict people of color's access to benefits. So the first point, I'm going to make 2 points about this one. And the first is that there has been previous research that has found that lifetime discrimination is associated with food insecurity. And we have some examples of that in our study. And one of the people in our study was KAITLYN. She was a mother of 5 from Sioux City, South Dakota. And she had planned to go back to work when her youngest child, a few months after her youngest child was born. And that was around the time of the pandemic, but she ended up deciding not to do that because she was afraid that she would get COVID, that she would get sick, and that she'd get her children sick. Her parents lived on a Native American reservation in South Dakota. They had both had COVID. They had both had very severe cases. Her mom had a stroke and her dad was still in the hospital and a rehabilitation center when we talked to her. And so KAITLYN was really afraid, and she said she and her children were staying inside, and she had even cut her grocery store trips to 2 times a month to try to limit her exposure. So KAITLYN was Native American, and one of the things she talked a lot about in her interview was all of the discrimination she had faced as a result of that. An example she gave was that she wasn't approved for rent assistance, and she felt that was because of discrimination. Her child had been bullied at school and ended up cutting off his braid to try to stop the bullying. And she had applied for jobs and felt that they discriminated against her because of her last name, which identified her as Native American. She did receive SNAP, or food stamps, but she didn't receive unemployment or anything else. And she talked about having gone to the office in her county and experiencing discrimination there and giving up and not trying to apply it. And KAITLYN was experiencing food insecurity, and that kind of assistance would have made a big difference for her. So her case is an example of how interpersonal discrimination can contribute to food insecurity, for example, by not letting someone get a job or by restricting access to resources. It also shows how structural racism is linked to experiences during the pandemic more broadly. So, and one thing is that COVID infections have been really high on Native American reservations, like where her parents lived. And this is tied to inadequate resources and infrastructure, basic infrastructure like having clean running water and also having adequate health care. And then the other thing is that South Dakota was one of the states that deliberately avoided implementing almost any protections for people from COVID. And a lot of the people that we interviewed in that state had COVID. And in KAITLYN's case, she didn't get it, but she was terrified to go out, which made it harder for her to access food and to do other things. And then the other thing is that the kinds of food assistance that I've been talking about are implemented state by state. And eventually all states did implement it, but in South Dakota and in a lot of the states with more conservative governors, it was later than other states. So they had to wait longer. But my last point is that racist structures and ideologies does not just mean direct discrimination like KAITLYN experience between specific people, but it can also be written into policies. And one example is that pandemic supports and other forms of federal food assistance and social assistance were often not available to undocumented immigrants or even families with mixed status, which would be like some people in the family are undocumented and some people are citizens. So for example, mixed status families did not get the stimulus checks that people in the US have gotten, even citizens if they lived with an undocumented immigrant. And then undocumented immigrants are also not eligible for SNAP. So MAGALY was one of the people we interviewed. One of our graduate students interviewed her for their dissertation, and she was a married mother of a 14-year-old and also a Mexican immigrant who had been in the US for 14 years. She was working as a house cleaner at the beginning of the pandemic, and her husband was a day laborer. So their income and work fluctuated normally, and then she lost her job immediately in the pandemic because people didn't feel safe letting people come into their homes. And so the pandemic was hard enough for them that MAGALY sought out SNAP benefits, which her daughter, who was born in the US, was eligible for. So she was very afraid to do that because of the anti-immigrant rhetoric, and we heard that a lot from people, but she did it because they really needed it. But because of the documentation that they needed, a language barrier, and what she perceived as discrimination, she gave up before she ended up getting it. So instead, she tried to coupon, and she started going to food pantries, even though she felt very ashamed to do that and didn't really want to do it, and also talked about how the food was not things they would normally eat. And we heard that a lot from the immigrant moms, especially in our study, of getting like canned food and processed food that was unfamiliar and unappetizing. And so she had to adjust to that and try to make it work because that's all that they had. And she, in the end, described her situation as relatively good because they had something compared to some of the other people they know. But she also specifically said that it was hard to be an immigrant during the pandemic because, in her words, even though we contribute, we don't receive any benefits. And I'll just note that this interview and a lot of our interviews took place while Donald Trump was still the president. And people talked a lot about the anti-immigrant rhetoric, including coming from the president. That has toned down a little now that the president is not literally tweeting it every day. And there have been some important changes in policies, including one just this week. But deportations have continued in the Biden administration. They were very high in the Obama administration. It's not just that one president. And the confusion, distrust, and exclusionary policies are continuing and are continuing to be a challenge. So this is my last slide just to conclude and then open it up for questions. If we step back and think, what did we learn? Where do we go from here? What might this lead us to advocate? I think there are a few things I can think of. So the one is that it's possible to alleviate administrative burdens, which are kind of like purposeful hoops that deny people benefits. Emergency food assistance programs were implemented quite quickly and quite fast. They reached a lot of families, and in many cases, like with that program that gave benefits to people that were getting school lunch, they happened automatically. People didn't have to sign up for anything or do anything. So this made a huge difference, and I think I cannot really imagine what food insecurity would look like if that hadn't happened. At the same time, we also know that the way that these programs are administered in the US, which is kind of like state by state, is one of the ways that structural racism occurs. Poverty assistance and food stamps specifically are politicized and also racialized. When President Obama was the president, there were lots of talks about him as the food stamp president. And SNAP use did go up because we were in a recession then as well, but that was a racialized linkage of Black people with SNAP and with food stamps. And the states in the South that have the highest rates of food insecurity also have the least generous and the most punitive social assistance programs. So some things are kind of decided at the federal level, but some things are vary at the state level, and that contributes to structural racism. So the second thing is, what are we doing for all these people that are just left out altogether? Food assistance programs, as I said, are one of the last kind of pieces of our welfare state. And so they are critical to survival. And so when people aren't eligible for food assistance, and specifically SNAP, it makes it that much harder. Immigrant families like the one I talked to Many of them were essential workers. They're keeping everyone else fed and cared for, and then they weren't eligible for lots of this assistance. So can we reconsider how we determine eligibility and make it more like school lunch, which it does not restrict on the basis of citizenship, and maybe even go further, because school lunch during the pandemic has been basically available to everyone regardless of income, and which kind of proves that we can do it if we want. We just normally can't sustain the political will to do it. Then the next point is that SNAP functions as a work support. So if we actually kind of deal with these low-wage jobs and make them better jobs and add these work protections, we can make SNAP not obsolete, because not everyone can work, but we can make it close to obsolete. So many of the food insecure families in our study were working, but they had jobs that didn't pay living wages, and that is true of SNAP recipients in general. Around 50% of SNAP recipients that are not disabled and who are adults worked right when they were getting the SNAP, and about 3/4 worked in the year before or after. So SNAP fills in when people lose their jobs, but it also fills in when they have bad jobs that don't pay enough or don't give them kind of guaranteed schedules and work protections. If we pass, for example, the $15 minimum wage that's being debated right now in the US, we can make it close to obsolete. And then the last thing is that food insecurity is an indication of the care crisis. Mothers do a lot to try to prevent food insecurity from affecting their children. They sacrifice more, and so they experience more health effects from food insecurity than other members of the family. That's pre-pandemic, other studies. And we see this care crisis playing out in bigger ways during the pandemic too, with mothers being the ones who are dropping off out of the workforce, and mothers of color especially being unable to sort of juggle work and childcare and having to drop out. And they're also the least likely to have the resources they need to support their kids' schooling in this context. And we had moms talking about going to McDonald's and sitting in the parking lot to try to connect to the Wi-Fi. So we need to support mothers and families in terms of reopening schools safely, but also in terms of childcare for little kids and child payments, which we just passed a bill with child payments yesterday, which is like unprecedented, and nothing like that has happened in many years. So I think maybe we're starting to think about this, but that's the last point that's very important. And with that, I will wrap up, and I'd love to hear your feedback, including critical feedback, as well as your questions and anything you'd like to share.
Great. Thank you so much. That was really, really fascinating. I think so much of it resonated with, I guess, experiences in the UK in terms of the racialized impact of COVID here, and also, you know, in terms of the research we've been doing about the kind of gendered of childcare and food work, which has been really, really sort of prevalent. I think Julie can unmute anyone who has a question. If you put your hand up. Are there any questions? But I can start off with one in the meantime, which is, you mentioned at the beginning, we'll be doing six months later, you'll be doing kind of interviews again. How do you, a bit of a difficult question to answer, but how do you see things progressing in terms of what it's going to be like in 6 months' time?
So because it ended up taking us about 6 months to do all of the interviews. So like basically we need to start doing the follow-ups daily, which I'm sure lots of people understand, because field work, it always seems to proceed according to a slightly slower timeline, at least than I anticipated. So I think based on that, I have some ideas. And we also have been asking people what they predict will happen. And in terms of jobs, people are getting jobs, schools are reopening. So in that way, I think, you know, some people are doing better, but in terms of the food assistance, some of the pandemic supports, I mean, none of them have actually been discontinued, but there have been periods where some of them lapsed. And so we saw that, especially in the fall, that things actually got worse for some people, because, you know, they hadn't necessarily, the jobs hadn't improved, but some of the pandemic supports lapsed. In 6 months from now, I think it's hard to say. And I'm just thinking about what people predict for themselves, because we're asking that question. And some of them are hopeful, but a lot of them this does worry me because I think a lot of middle-class families are starting to feel optimistic right now. Like the vaccine rate is going up. People are like kind of getting into this mode of like, we're going to get back to normal and it's going to be fine. And I feel like comparatively, a lot of the poor and working class people we've interviewed, like it wasn't fine before. So they don't have that same level of hope. And I'm nervous. I'm nervous about whether we can sustain the political will to solve these problems once not everyone feels like they're in this crisis. So I'm not sure.
That's really interesting. Just one more question for me. In the UK, there was debate around, I guess, a few months ago about food parcels that were being given out for kids who weren't in school, and they were seen to be like kind of nutritionally, bankrupt and very little food for the amount of money that the companies were charging the government. And then it sort of started a debate around, food versus vouchers and things like that for parents. But one of the things that we found interviewing parents in our study, and I don't know if you experienced this as well, was just the kind of sheer exhaustion of parents, aside from whether it was money or a box, having to prepare meals day in and day out for their children, and the kind of, even people who wanted to, I guess, might have cooked, nutritional meals all the time. It just sort of became impossible in terms of, and it was always women obviously doing all of that food prep. Was that something that you sort of picked up in your interviews at all?
Yes, I think I kind of expected almost everyone to talk about that, like just this like sheer relentless. I feel this way. Not even the main food preparer in my house, but just like the endless washing of dishes and all of it. And a lot of people talked about that burnout, and especially that with the kids home and with everyone home, like there's just a lot more of that labor, and it never really stops. There's no break from it. And then I think like the other thing is that in these food insecure families, like then the other challenge is that even if you like it in theory, when the food stamps run low at the end of the month, then you're making do with these like really weird ingredients, and that like really sucks any pleasure out of it. But we have had some people talk about like cooking as sort of like some people, I would not say this is the majority, have talked about like valuing it more in a way, because like so many things have been eliminated, but you can still gather around certain foods and special foods. And I have thought about it because my last book was on home cooking, and it was about poor families cooking. And one thing I've just thought about is that during this pandemic, I think middle-class families have experienced what the poor families in our study were experiencing before this, because they could never really get takeout or go to restaurants, so they had to cook all the time. And now like everyone is in that boat. And so like, I think that's also part of it, that middle-class families are like having to cook all the time in a way that a lot of the poor families in the previous study were already doing.
Interesting.
It was brilliant. Thanks, Sarah. Sorry to interrupt that, Anna. But yeah, really good. And we've had positive feedback from people in the chat as well, saying thank you very much. Oh, and we've got a question. Sorry, I was going to ask a question. I'll leave those questions and ask my question, if that's all right. I was really interested in well, I can't remember the name of the participant, but when she talked about visiting the food banks, and they got sort of strange sort of tins of things, and I just wondered about that in terms of the cultural aspects, because they're getting things that they wouldn't normally buy, and the added pressure that has on people for then trying to create meals. It's a bit like us, if we got our shopping mixed up, what would we do? And the implications for that. I wondered if you could say a bit more about that.
Yeah, I think so we knew even before the pandemic, but I think it's been made worse, that for the immigrant families in our study, almost all of them were from almost all of the ones have been from Mexico or Central America, so from Spanish-speaking countries. And we knew before, but I think it's gotten worse, this like that the having to rely on food pantries, because these are the families that are the least likely to be eligible for federal assistance. So the food pantries are really all that's there in that case. And also with the fear of kind of interacting with governmental programs, the food pantries are separate from that. But then the foods being like weird, unpalatable, unusable, and people, all people they are always like careful to say, and I think they really believe, this is like true, that they're grateful that they can get help, but like the food itself is, it's humiliating and not very useful to get these foods that you can't use. And then also some of the foods are expired. And, you know, someone talked about, I don't remember who this was, but someone talked about when you go to the food pantry, they give you a paper. I think this was another Latina immigrant that explains that you can use expired foods up to certain dates, which I think that's actually true. Like we have some kind of arbitrary expiration rules in the US, but like people that are already ashamed to be going to a food pantry, that are working really hard to protect their kids, like it is humiliating and demoralizing and totally inappropriate to receive expired food. And, you know, in the case of Latina participants, they talked about how they would normally use lots of fresh food and lots of ingredients, but then it's lots of cans. It is a hard thing to solve because the food pantries themselves, especially this year, they're having like super increased demand. Lots of people that have never gone to a food pantry before going to them. Like there have been lots of stories in the news of these extremely long lines, miles and miles of cars. But so they need more support so that they can improve their offerings, because we expect them to kind of fill in for these gaps and it's just not possible.
Thank you. I'll leave the other questions for Anna to ask.
Great. Thanks. We have one that was in the Q&A. And says, thank you for a very interesting, informative presentation. I was wondering about the photos of the food environment that were taken during the research. Who took those pictures and how were those photos used?
So we really need to analyze them more. We, so far we've used them in the interviews, and oh no, I took that one out. So I ended up, the people in the slides were not, it was not their real names, and those were not pictures of the people. Those were pictures that kind of represented who represented them. And I tried to make them kind of like reminiscent of the person, but they were not their names or photos. But anyway, so we collected around 10 to 15 photos for everyone. And then we organized the second interview around that photo and around those photos. And we started by maybe kind of going through all of the photos, but then saying, why don't you pick a few and we'll just talk about them. And an interview that I just did a few weeks ago, something that was interesting was that the photos themselves, and this was often true, like, I don't know, people didn't necessarily know what to take pictures of. We also said, like, let's try not to include people because we can't include identifying things if we ever, you know, did a display, but it's kind of hard to take good pictures without people in them when it's about eating and cooking. There are always people in those photos, shopping. So, you know, the photos themselves are kind of weird sometimes. And these, like, they were like plates, and I was like, I don't know, but we started talking, and like it led to all of these conversations about that had not come up in the previous interviews, even though I thought we kind of covered the topics about, you know, this person had a food shortage that hadn't come up, and one of her friends had brought her a plate. And so she'd taken this picture of just like a pan with a bit of rice in it. It wasn't like something that I really, but it led to this whole conversation about how the friend had brought her this dish and then it reminded her of rice, and someone else had let her down, and kind of a more complicated story of food insecurity that I don't think we would have heard without the photos, especially doing these interviews we're doing them over Zoom, but also over the phone, depending on what people want. And a lot of people don't have the kind of internet to want to do them over Zoom. And so over the phone, it's hard to connect. It's much harder to build rapport. And I think the photos help with that, to kind of have something to focus on.
Yeah, I think it's such a fascinating thing to do these interviews where you might just have no idea what the person looks like at all, and all of the cues that you would normally pick up. And it's kind of almost strange seeing a photo then when you have an insight into someone's life, having not seen any of that. There's one more question in the chat, which is around the effects of pandemic food insecurity on food preparation. So do your interviews reveal how people cook?
How people cook?
Mm-hmm.
I think, yeah, that's a good question. And I'm not sure to think specifically, like before this, we were doing a project, and that's what our second book is about, that was about like food insecurity. And we did 5 years of research. So kind of longitudinal families in North Carolina. And a lot of that was on food access and cooking. So I definitely have thoughts based on that. Thinking about like the pandemic specifically and whether that has changed, I'm not sure, but I think the main things are in terms of food insecurity in general, and I think this is also true during the pandemic and maybe even worse, are that a lot of people said they couldn't afford a lot of fresh produce. And it wasn't necessarily just like where the stores were, but basically a lot of people would try to reduce their shopping trips even before the pandemic, maybe even more during the pandemic. Partly it's a budgeting strategy during the pandemic as a safety strategy. And so maybe they get a few things and then that will be it. So that was one thing. Definitely endless talk of the end of the month, like people consistently the whole time have talked about ramen, noodles, and hot dogs as you're like, that's what you eat when you're hungry. And we've had people talk about like learning how to cook hot dogs in different ways, you know, kind of trying to reconfigure those into different things so the kids don't feel like they're eating the same thing over and over again. But those as kind of bologna sandwiches, as things that can like fill you up for a really cheap price. And then something that I think is true during and before the pandemic is like most of the people in our study, they cook from home, they don't eat out. Even McDonald's is like too expensive. So what people can do, but like processed foods are basically all you can do. Like they can't, when they're tired and they don't want to cook, you can't go out to eat, but you can cook like easier things like frozen things or processed things. So that is kind of a strategy. And then also that is a strategy for picky children because nutrition experts, at least in the US, say that you're supposed to feed a child something like 15 times. You're supposed to try to feed them something new so they'll start to like it. But that leads to lots of food waste. So we've had lots of people talking about like, you can't afford to waste food. So then you end up feeding kids like the kind of same staples that maybe aren't as healthy, but at least you know they'll eat them and you don't have to throw that food away.
Great, thank you. So there's another question in the chat. It says, so you mentioned one parent was able to go back to work when a neighbour started helping with childcare. Was this kind of informal support from family and friends a kind of common theme? And what experiences of informal did people speak about? And how did that impact food insecurity?
I'm so glad that someone asked this question because I wanted to talk about it, but it didn't fit as well into my like figuring out the talk. Like that is one of the things I've been the most surprised about, how much informal support people are offering each other. And with childcare, but also with food. And we've had many examples of people, and most of the people we're talking to have experienced food insecurity. Many of them are experiencing it as we talk to them. In many cases, they've had these periods of hardship that are very severe. We've had quite a lot of people, more than I would have expected, experiencing housing insecurity and homelessness. And still, I would say most people are offering support to others. And so like an example was someone I interviewed who had been homeless. They'd lived in 2 houses already during the pandemic because they had to keep moving in with relatives. She'd been out of work for several months and she was still like cooking, bringing plates to her old neighborhood where she knew that people were homeless and needed food. They volunteered at the food pantry, and she was very COVID cautious because her daughter had these health conditions, but she said, you know, we just say a prayer before we go in and hope that it'll be okay. And we feel like we have to help others. And I think there've been a lot of like kind of mutual aid networks, including from the internet, Facebook. I'm in some of those groups, partly as recruiting, but seeing people just offering food, offering meals, offering clothes, and asking for those things. So we have seen a lot of that, and more than I would have predicted, which is kind of striking.
Are there any more questions from participants who haven't asked any yet? Oh, Julie.
I'd like to know a little bit more about the methods. Is that all right? I'm really interested to know how many people you interviewed and how you managed to get people to participate. That'd be great if a little bit more about that. Thank you.
So we initially wanted to interview 20 people per county, and then we had 10 counties, so that would be 200 total with 2 interviews each. We ended up deciding to reduce that, and we wanted to do that in part because we picked the counties as in terms of variation, in terms of their COVID experiences and food assistance policies. And we wrote this proposal like last April, because it was this kind of funding grant that's a rapid grant, so you have to apply fast. And one thing that was striking was that like the cases kept changing, like places that seemed buffered from COVID, like later were the very worst of all. But still there's a lot of variation by place. So we had wanted to do enough interviews in each place that we could really see, like kind of compare across. But the recruiting has been slower than we had expected, although I feel like that's something that you kind of can expect. So I don't know. So we ended up switching to 15, and we're getting close to that. So that'll be 150 total, with 300 interviews total in the first phase. And we have done a lot of the recruiting through Facebook, more than I would have expected. We have a lot of community contacts, and that's part of our grant team, and we did that. But some of the people we knew, like those community contacts, some of them worked, like they could send out an email, but like people weren't going to places in the same way. So we ended up using Facebook more than I would have thought, which has been pretty easy. And I think that one benefit of the all of my research before has been in person, and I think there are some definite advantages to being able to do in-person interviews or ethnography, but it has been interesting to be able to like be working in all of these counties, much more places that don't usually get studied because they're far from universities. And so that has been a benefit, and social media has definitely made that easier.
We've also done a lot of recruitment via Facebook over the pandemic, which is not something I kind of thought about using that probably as a means before. And one of the things I think it's probably helpful for is that people look at Facebook groups who aren't necessarily part of kind of more traditional organizations. So I'm hoping that one upside of all of this is that it means that we've been able to access people who wouldn't normally be people taking part. But, we're just coming, I guess, quite close to the end, but one more question here. I know you talked about the photos a bit and you're sort of still planning to analyze those. Just a question on how you plan to analyze the photos.
So I have never done a photo voice project, and it was one of the people in our team. We're working with people at students, but also professors at 4 other universities besides ours. And so I think she will take the lead in terms of like coding and kind of analyzing for themes. But one idea she had that I think we are going to try is to use them in round 2 too, in terms of like possibly sharing some of the photos with participants, so that it's not to kind of disrupt this like basic model of like we interview them and it's a relationship, you know, they talk to us and it's a bunch of spokes, but no one interacts with each other. And we're obviously not, or we actually did consider like trying to like organize virtual focus groups or something for phase 2 so people could interact, but it seemed too hard in terms of recruitment because we have lots of people changing the interview at the last minute because of all these like pandemic disruptions, but also in terms of maintaining trust and making sure everyone feels safe. But one thing we could do is share photos so that people in Mississippi could see photos from Michigan or North Carolina. And so I think we are going to try to analyze the photos like in papers, but also use them to sort of generate the next phase of interviews in a more participatory way.
Thank you. I think we have time for like one more question, I think. Julie, you've got one more.
I just want to say, I hope you can come back and talk to us again, because it's really fascinating and you're going to have some amazing data, and it'd be just really brilliant if you come back in 6 months or so and share it with us, because I think there'll be, you know, a lot of interest, and, you know, there are other projects going on in the UK, so it'd be really interesting to do some sort of comparison, I suppose. Yeah, so I hope you can, because that was brilliant, but yeah, I hope you can come back and talk to us again.
I would love that. And I think it is, I mean, I do, and I'm fascinated by the study that Anna and others are working on. And also just like kind of, I think it's true, like the US and the UK, which are very different in terms of a lot of these kind of welfare state kind of policies and how things have played out. But then there are some commonalities, it seems, in terms of food insecurity and food shortage, which to me is a bit of like a mystery and kind of something to untangle too.
Great, thank you. Well, we're just coming up to 5 o'clock, so I think that's probably all the time to end, but really fascinating to listen, and I can't wait to kind of hear the next installment of findings, and look forward to also having more conversations with you about the work we've been doing and where that similar and different. Well, there's just one last question, which is that is there anywhere to, once the report's ready, is there a study website or anything where people can sign up for updates on the research?
We do have a study website, but if you email me, we do have a database of all of the people we've interacted with, and we can add anyone to the list. So if you, my email is sarah_bowen@ncsu.edu, but you can more easily probably just Google me, and Sarah Bowen at NC State or Sarah Bowen, North Carolina University, that Google will get that to my email. And so if anyone wants to email me, we can easily add you to the list and send updates when we have them, which we hope will be relatively soon. And thank you all. This was super great and really fun to present to you all. And my daughter, who is 7, was super excited because she studied England last year in school and was like, you're presenting to the UK. This is so exciting. So I'll have to tell her when. It was fun. And thank you.
Yeah, thank you very much. And yeah, fingers crossed there'll be some in-person research activities at some point in the next
someday,
5 years that
maybe.
We'll discuss that.
Thank you all. This is really good. And thank you for the great questions.
Thank you. Brilliant. Thank you very much. I'll end the show now, and it's going to be on the BSA YouTube channel, so people can tune in and watch at their leisure as well. Okay, thank you, Anna, for sharing. That was brilliant as well.
Pleasure.
Thank you so much, Sarah. That was fab. Thank you. So
thank you. Have a good night, everybody.
Bye. Bye.
Bye.